Good morning, all. This is Dr. Vignesh Kumar. Today, I just wanted to publish the fear avoidance recovery of the cycle. Nowadays, the low back pain become a leading cause of disability worldwide. Recently, Peter Sullivan, a physiotherapist, published in Curtin University in International Pain Society conference. So, I have attached the pictures below. So I had seen a patient with chronic back pain, say for about a year, he is having a persistent back pain. So he is working in Singapore as a hotel server, and also he used to see a cashier work also. So often he has to lift the things and serve and clean the table and come back to the cashier section. So he will be more busy person. At landed with a severe back pain, I took a MRI, disc degeneration, L4, L5 mild bulging. This is the simple thing he had. So the MRI has been explored and it has been explained to the particular patient. His name is Sam. So it has been explained to him by the doctors that MRI shows severe disc degeneration, disc bulging. So if it elongates, first you take physiotherapy and medications. If it does not get subsided, have to go for surgery. So he keeps in mind, and this is elongated continuously. So for him, so he got severe sleeping issues. He got grief in his mind, so emotions, distress, and he is having a panic while bending forward, while lifting something. He has some little bit pain. He got panic. Due to that, pain will become more flare up. So that is the main important issue which is happening. So flare up of the pain condition is more and more. So he tried all sorts of passive therapies, which is giving a short-term pain relief. So pain relief is there, but short-term. Say for example, if he takes any passive therapies like manipulation or traction or IFT or massage, dry needling, cupping, decompression therapy, whatever the therapy, it has been persistent for 2 to 3 months. Again he'll be recur back. Like this, 1 year has gone. So he tried spinal injections, severe drugs, strong dose drugs like opioids, and he has been finally recommended for the surgery. This is his final stage. So finally he took a leave and came back to India, and he fixed on physiotherapy treatment in Madurai, somewhere else in private hospitals or some private clinic. I don't know exactly. And he told me there is a package. You had to pay 10,000 rupees per day. So morning 3 hours, afternoon 2 hours, evening 3 hours. What they used to do, decompression therapy, cupping therapy, dry needling, massage, manipulation, so and so. So lot of treatments has been taken on one day. I got wonderful relief for 1 week, and I never have a back pain now. I had only sore back and difficulty, apprehension in going for the forward bending. This is his problem. So I said, how long you are free now? I am free for a week. So I checked him, his slum test, his positive SLR test, all those things. So I told him, you are not having any major issues. I seeing the MRI and other things. Don't worry for, you just keep your MRI in our coat stand. So don't think of it. So just come out from that. Don't get worry for your back. Your back is not get damaged. So once you are bending or doing any physical activity, exercises, if you get a pain and flare up a pain, you won't damage your disc. So it is not harmful. Like that, I spoken to him personally, communicate him and educate and advise him to do a lot of physical activities. And I explained first, I check him, he is having a protective guarding spinal movements. He's not able to bend properly because of his previous episodes of advice not to bend, not to sit, not to put shoes by bending forward. So he used to bend the knees and keep the back straight, and he used to do that. So I advise him to relax the spine, keep deep breathe and relax your spine and try to do engage in relaxed activities. If you get a pain, you just keep relaxing and try to do it again. So just try halfway, then again full way. So you're bending, the motion is the lotion. It does not worsen your spinal structures. So don't worry for spine is getting damaged like that. So finally, he is very happy, emotionally calm and happy, and tried relaxed, physical engaged activities like gardening and playing shuttlecock, all those things, and started working in hotel as a server as well as cashier. He is returned back to the job. So living back again. This is the avoidance scale. So I have put in another picture a Sam's journey. The Sam's journey, which was explained, is another patient treated by Peter Sullivan in Australia, Curtin University. He took very clearly that making sense of a pain. Sense of pain is emotional feeling, thoughts about worsening of the spine structures because of the drug overusage, MRI, education, all those things which gives more distress to the patient. So we should see the patient as a whole human being. So treat them as a whole human being. So patient centric approach is very, very important rather than treating the symptoms, passive modes of therapy. Please avoid low value care. Give a high value care which consists of biopsychosocial model. So you should just see the sensitization of the back. So your back is getting sensitized, that's all. So don't worry and try to do a movement forward, backward, twisting, bending, relaxing. All are good for your spine. And do a good physical activity in the morning, good food, good sleep. All these issues are bringing the patient to this disability level. So if you train all those things, educate them psychologically and try them physically, tailor-made them, give a self-management plan. According to that, the patient will get the life back again, living again. So disability will be reduced and pain will be reduced. So life will restore back again. This is a good thing happens by cognitive functional therapy. I am proudly wanted to say I've been trained from Peter Sullivan online. So this is a wonderful therapy, has to be practiced in India, especially in Tamil Nadu. People has to come forward with a chronic back pain, not depending on medications, surgeries, injections and passive modes of therapy. They have to come back with this cognitive physical therapy whom they are doing, and they have to examine properly, speak with the patient. Personal communication just shows the skills, whatever the knowledge acquire, educate the patient and bring back to them by giving a tailor-made exercises program. Educate them slowly, make them to do physical activities and bring back the life again. Thank you one and all. Thank you.